Hi, this is Dr. Jason Tripp, chiropractor and naturopath right here in Hermitage. And today we're talking about sciatic pain. And so I used to have sciatic pain for years. I went to chiropractors, I went to naturopaths, I went to medical doctors for medication and physical therapists for therapy and acupuncturists to have the needles done and you name it. I mean, I went to osteopaths, whatever. I went to all of these different ones and I could not find an answer for sciatic pain. It was horrible. I even was out of work for almost a year due to the pain. But I'm here to tell you, I did find a way to get out of sciatic pain. And so if you're having sciatic pain, we're going to be talking about how to help you, how to get rid of it, or how to reverse it. Put a yes in the comments below. Or put, if you're watching this and it's really for somebody else, you're just wanting some information, then put a no in the comments below. And that way I'll know that you're not the one watching it for yourself, but maybe you have a friend or a loved one who's in there. Just have some interaction with us. Also, if you have questions about sciatica, something that I'm not going to answer here in just a minute, go ahead and write that question in there and I'll see if I can get that answer to you as soon as possible. Sciatic pain, though, there's a culmination of 4 nerves in your lower back that actually all grow into one nerve, and then that one thick nerve goes down and feeds out the leg. Now, where it's together, that's when they call it that sciatic nerve. If any one of the spinal nerves get out of line and start to rub and wear and tear like this, it can develop damage to the disc. When the disc bulges or herniates, and that's just depending on the size, if it bulges or herniates and pushes out, you can develop sciatic pain. In most cases, the sciatic problem is developed because of a bulging disc or a herniated disc in your lower back. So if you're having sciatic pain, you want to find out, is there a bulge or is there a herniation in that lower back? If there's not, there's a different type of exam we can do to find out why you're having sciatic nerve pain. So we do a sciatic nerve pain severity evaluation. How bad is that sciatic nerve? Is it a little bit damaged and you're in terrible pain? Or is it a lot damaged and you're in terrible pain? Like, your amount of pain doesn't tell us how bad that nerve is. But the exam, are you losing feeling? Are you able to move it? How is your strength? Like, there's multiple things we do. We actually address all 9 factors that affect neuromusculoskeletal disorders. In other words, nerve and muscle problems. And so we go through the exam, we find out how bad that sciatic nerve is. If it's beyond 85% damaged, I'm going to be recommending go see your surgeon to see if there's some kind of surgery you can do. And in less than 85% of cases, you don't have to go to do a surgery, and there's ways to help it, just like I did. I had herniated disc in my spine, in my lumbar spine. Sciatic nerves were affected, and I was limping around out of work, and I was able to get better, and now don't have sciatic nerve pain. And I want to show you how to do it too. So you don't have to suffer with sciatic nerve pain. If you've had it a couple days, obviously you want to get right in. Any sciatic nerve pain is obviously a nerve disc issue. It's not just a tight muscle. Don't think if it's running down your leg that that's a normal thing or that that's just a tight muscle. That's not what that is if you're having a pain running down the leg. Most of the time, if it's in the back of the leg, that's going to be that sciatic nerve. You want to get checked. You want to make sure how you are and what you can do about it. Now, if there is something that can be done, you're not beyond the 85%, we usually will recommend non-surgical decompression. Now, if it's non-surgical decompression, is where we separate that disc just gently like this, pumping fluid into the disc. And when you do that, you can actually restore that disc back to its normal place. So if it's a bulge or herniation, you can restore it without surgery. So if you want to have no surgery and bring down the pain of your sciatic nerve, then I'm definitely going to say give the office a call and let's talk about what can be done to reverse that pain of your sciatica or even eliminate it altogether. Now, some people have waited so long, it can't be eliminated altogether. You're just going to have to live with a portion of it, but we want to be able to do the exam to find out how much. Most people, you can get 100% relief. And so the goal is to get everybody to that 100% relief and get you back on track, back working or playing or hanging out with the kids or, playing ball or what have you. All the things that we love to do, that's actually, we want to get back to doing those things again. So if you're looking at a sciatic pain, you were thinking about surgery, I'm going to say hold off if it's possible and just come in, get the exam, find out what's going on, and we'll see you together if there's something that you can do. So again, this Dr. Jason Tripp. If you want to call the office, call at 724-342-2225, and I'll be glad to help you out. Thanks. I'll talk to you soon.